What is going on, guys? Thanks for tuning in to the next episode of the Three Peaks Fitness Podcast. I'm Coach Mark.
I'm Coach Lynette.
And today we have a very special guest. Dr. Gabby Mace is joining us.
Yeah.
Dr. Mace is a doctor of physical therapy with Pioneer PT. You guys specialize in typically working with, mountain bikers, hikers, outdoorsy types of people. We're very excited to have you on. So why don't you kind of give the rundown, the 90-second rundown? Who are you? What do you do? What's your background? All that good stuff.
Yeah, thank you both for having me. I'm excited to be here. And I was telling Mark and Lynette before this is my first in-person podcast interview because during COVID, it was all over Zoom. And I was thinking about it. I was like, this is exciting.
Oh, yeah.
But yes, I am Dr. Gabby Mace, and I am a hiker. I'm a runner. I love just movement and activity and people. So, my background, I have a doctorate in physical therapy, and I have I'm new to Maryland. I still think I'm pretty new. I moved here a little over a year ago for my position with Pioneer, just like Mark described, and we'll talk a little bit more about it later. So, yeah, I'm excited to be here today and just talk about a lot of important things.
Awesome. I have a quick question. What drew you to being a physical therapist? Have you always wanted to be a physical therapist?
Great question. So I was one to just be always playing a sport in my life. And my primary, sports were soccer and basketball. I feel like for a lot of people, they usually start or play that. And then I chose soccer. I really thought I was going to play in college and, doing the competitive travel soccer for those who are listening and have kids who do that. You know how intense it is. And I, found myself getting injured and going to physical therapy. I also did have family members who were physical therapists, so I got to at least talk to them about it, and they really inspired me. They're like, yeah, you would, be a great fit for the profession. You're active, and I didn't want to be at a desk, position. That just wasn't me. I knew pretty early, I would say my freshman year of college, that I was going to go that route, and and I'm still here today.
Cool.
Very cool.
Nice.
All right.
All right. So kind of let's jump right in here.
Yeah.
Let's jump right in. So as a physical therapist, what injuries, actually, I'm going to change the question a little bit on you. All right. So as a physical therapist, what were the most common injuries that you experienced with your clients? Mm-hmm. And then how have those common injuries changed over the last couple years?
Oh.
Are there new common injuries that you're seeing, with the pandemic and everything?
Oh,
yeah.
Oh, that's a good one.
I like that question.
Yeah.
So I would say to answer the first part of that, the most common I see is definitely foot and ankle. I'm working with a lot of runners and hikers, and, we're always on our feet, so our feet are very important. So foot and ankle, even prior to pandemic, plantar fasciitis, we all know that term. That's pretty a popular, spot that I treat. Low back pain, that's also, very common. And again, before the pandemic, that's always been something that I feel like we all go through a bout of some sort of low back stiffness, pain, like sometimes or pretty much all in our lifetime. And I would say the last thing has been like neck and shoulder. I usually pair those together because it is related. But going to part B, during COVID, a lot of people, were over Zoom and still working, at their desk. I think since the pandemic, ergonomic, outfits for your desk have been more popular. With standing desks, everybody has probably heard of a standing desk or has one, making sure like your computer is elevated. So there has been more out there with making sure you're ergonomically set so you aren't being prone to, overuse injuries from sitting, in this posture.
Yeah.
For those of you who are listening, if you just like slump your shoulders, get in the worst posture, forward head.
Yeah.
So even prior to pandemic, that's always been a thing. But I think now more than ever, with the amount of stress and, especially parents homeschooling. It's just been more and more popular, and people want to, like address it now rather than, I would say pre-pandemic, they're just waiting until like, all right, I can't do my work. I can't be productive. What, now I need to go to my doctor. So I think it's gotten earlier of that prevention side and making sure that you're set for success, because no one wants to be in pain.
Yeah. So people are coming in sooner. They're not waiting until critical mass.
Correct.
To come in. Oh, that's good.
Yeah, that's good.
Yeah,
Exactly.
that's good.
Yeah.
I would say that's especially now, and for those who are listening, you probably can, track if you do primarily work at a desk or, sitting a lot, then saying, oh yeah, like I've had neck stiffness, mid-back stiffness. So I think people are addressing that earlier now.
Yeah. What do you, because we've definitely seen a surge in lower back issues, the common things, but particularly lower back. What sort of suggestions do you have for people to, prevent the lower back issues from flaring up? Or maybe if you're experiencing stiffness, in at this present moment, what sort of things can people do to make sure it doesn't turn into, excruciating, oh my gosh.
Yeah, exactly. So I think a big thing, because we think of low back and for general population, we think of damage to the spine. And there is, I just want to, debunk that in a sense, because a lot of the times it's, unless you're in like a car crash, there's some sort of trauma, you fall, then it's usually like impacting the spine, but just lower back pain in general is usually originating from, musculature, myofascia, glutes. So making sure that you are properly strengthening, the muscles around the back, and just like, a lot of people too, if you have like tightness in the front, which we all see, that can put the low back in a more arched position. So I see a lot of people who have low back pain and just in this, just like, I would say chronic, like tense position. And they've always been like this for years and years and years.
They don't even realize it.
Yeah.
Okay.
Exactly. So I would say majority of the time it's more related to, the tissues and the muscles around rather than actual damage to the spine.
Wow, that's super interesting. Okay.
So the issues arise from elsewhere. Like when you feel it in your lower back, it's coming from, as a result of other muscles being either underactive or overactive.
Or overactive, exactly. Yeah.
Too short, too long, too tight.
Yeah, exactly.
Which is, I'm sure, exacerbated by the modern lifestyle, right? Even before the pandemic. Where, you're sitting in your car on the way to work, you're sitting at work, in your office, you go home, you're sitting on the couch watching. There's a lot of sitting.
Yeah, exactly. And another thing I do want to point out, because this is also scary when you go to the doctor and they tell you, oh, you have degenerative disc disease.
Oh,
the 3D word. And, to a lot of people, that's very scary. And you think that there's, actual damage. And a lot of the time, like imaging, if you get an x-ray of the spine or if anyone has had an MRI, some of the times what you're feeling and what the image says is different. And I think a lot of the times there's fear evoked with especially low back pain and, correlated to imaging. So I just want to say, if anyone has scared you and said big scary words, like, a lot of the time it's not as scary as it is. But when someone rephrases it that way, it's like, oh crap, like I'm broken.
Right. It makes it sound.
And they think they're thinking, oh, I'm going to have to go have surgery.
Yes. Oh yeah. Yeah.
So can surgery be avoided if you have a diagnosis like that?
Yes.
Okay. All right.
Now, and again, our common thing is it depends if there's any sort of trauma or, it's really impacting your life and function, then, other options are usually available. So that's a great question.
Yeah. And I want to follow up with another question. What is your opinion on, okay, so I'm working out, right?
Yeah.
my back, I feel something seizes up, right? I feel it in my lower back.
Yeah.
What is your recommendation? Should I just go home and just ice it and take some Tylenol?
Yeah,
Should
just go home
I
and quit workouts for a week or two?
What is a physical therapist's opinion of when that situation arises?
So you're talking about, I'm working out. We're currently at Progressive, for those of you who are listening. We're in the gym. So working out, we're doing, let's say, deadlifts.
Okay.
And you feel this we've all felt it, this just quick locking up sensation. Yeah. And you're like, you just your brain goes to oh my God, what did I do?
Yeah.
So I like to have a green, yellow, red of, especially when you're working out. Green meaning, say you you feel almost a tweak and you're like, okay, this is, bothering me, but then a few, exercise, it goes away within the session. Mm-hmm. Yellow is what you just described of okay, I'm doing this lift and everything just locks up and pain is present and you're I don't know if I can continue. A lot of the times I like to modify whatever is going on and doing. So with the low back, just doing some very gentle mobility to have it loosen up if it can. And then, red being this red flag, do not continue, you're on the floor in excruciating pain, can't continue, 10 out of 10, gotta go to the hospital type of thing. So I think, if that happens during a workout of just knowing, taking some time to, walk it out, see if it does decrease and have that, all right, this is where it's at right now, pain wise. Can it go down in the next, if the session's an hour and it happens, say at 20 minutes, you're doing that deadlift and then it's oh no, if it can go away or do some very gentle mobility and seeing if it does go away. Now, you mentioned ice. A lot of the times it's do I use ice or heat? So in the sense of an injury and that happens, right away, something that's all right, you hurt your back or ankle, twisted your ankle, I always recommend using ice first and then heat to calm down the tissue. So that's more later.
Okay.
Mm-hmm.
Yeah.
Okay.
Yeah. So if it's an acute,
yeah,
and they're swelling and whatever, then ice. But after that initial, event, you want to use heat.
Yeah, exactly.
So that sounds like a general rule for any injury, not just back.
Exactly.
Yeah. Okay, cool.
Yeah.
Now, so now it's 3 days. So we'll move on a second.
Yeah.
So it's 3 days removed from this back injury at the gym. I'm still feeling it. Maybe it's not as bad. Mm-hmm. Maybe still some pain. It's still stiff.
Yeah.
What am I doing then?
Great question. So I definitely believe you should still be moving.
Okay.
Participating as you can in class, but whoever you're, with, whether it's at Progressive or another gym, wherever you're listening, making sure you tell who is, teaching the class. Well, we're doing this in more of a group setting. So if you're by yourself, then different scenario. But if you're in a group class and you tell hey, I had this injury, 3 days later, it's still there. I want to participate. But you get the question of what do I do? So I always like to say, keep track of, where your pain is prior to starting. Mm-hmm. I say if it goes up more than 3 levels, so if we're using the 0 to 10 scale, say before you work out, you're at a 3, and then, 10 or 15 minutes in, you're getting up to that 6, 7, then that's usually the time to stop. Mm. But if you're staying in, within 3 levels, if it goes up a little bit, I think it's okay to continue. Mm-hmm. You're not doing, let's say more damage. Your body is just responding to this pain signal. Yeah. So making sure you have some modified movements and having that and telling the instructor ahead of time, so that you can still participate and move. You don't have to just like sit out and not do anything.
Yeah. Okay. So still try to be active, do what you can, move. You know.
I like the pain scale thing. That's really helpful.
Yeah.
Yeah, and especially when people say like, "Do I?" And you probably get the question of like, "Do I stop? Do I stop completely?"
Yeah.
And so using more of an objective of if it goes up 3 to 4 levels, and it's like you cannot continue, then usually that's that stopping threshold point.
Makes
I
sense.
like that. Yeah. That's super
awesome.
helpful.
Yeah.
Yeah.
Cool. So what are some, the back thing might be one of them, but what are some like age-related dysfunctions and injuries that you experience as we get old, as humans get older, right? Your older clientele, like what are some of the more common issues that you see when they come in?
Great question. So I would say neck is really common. Neck and mid back.
Okay.
Because for a long time, we all age. We all do have those, just, I don't want to say degenerative changes, but our body does go through that. So a lot of the time, especially for my, say older, let's say 50 and over population, people are coming in with this just like really bad mid-back stiffness. You can tell they've been in this
they've been like
posture
this for 30 years.
So I had a client who was a mechanic for years and years and years, so always in this like positioner on his back, and like it's really hard to, especially when it's been years of this. So I would say that's the first big age related changes. The other thing, which, and I want to put this in because it does relate to mobility and diet. If anyone has had themselves or knows someone who's had a frozen shoulder.
Yeah.
So
my husband had
your husband. Oh, okay.
Yeah.
Okay. So, a lot of, again, certain aspects and factors, but say you didn't have an injury, but you have some underlying medical, conditions like diabetes or high blood pressure. A lot of the time, if someone gets frozen shoulder and there's no, prior injury, the inflammatory markers attack those healthy, joints. So if your shoulder feels really stiff, there's usually phases of like, all right, it feels locked up. There's a lot of pain, especially sleeping. And then gradually you're getting into this unfreezing phase where things start to loosen up. But we're talking more about, age and diet, nutrition. So I would say that. And then there's another one. I don't know if you all have heard of it. It's called gout.
Yeah.
You guys know what that is?
My husband has that too.
Yeah. So, that also, nutritionally, if you're getting a lot of salt in your diet, then that can cause really bad inflammation. The typical areas are in your big toe, and your thumb. It can be in your knee joints as well. And it's a really, you probably know, it's
extremely
painful inflammatory response.
Yeah.
So those are more nutrition, but age related, going back to that, neck and shoulder. I see a lot of hips. So like, decreased like hip mobility. A lot of people over time, they get hip replacements. So I would say those are some common like age related as we continue to age and things start to be less fluid, we'll say. Yeah.
Okay.
So what do you do for these types of things? Like for the mid back, is there an exercise? Say someone wants to avoid the mid back problems. They're getting to be 45, 50 years old. Like, is there something they could just do at home to help their mid back?
Yeah. So one thing that's really, I don't want to. Easy to do. Again, if you have any pain, disclaimer, like don't. I don't want to excruciate.
Disclaimer.
Yeah. But even like the back of your chair, because we're in this again flexed hump posture. We want to get into that extended or more straighter
Sit up
position.
straight. Okay.
Yeah. So even at your desk, like I like to put my arms across my chest and just do some back, like again, just simple.
Okay.
Ooh, just cracked.
I heard that.
You may hear some cracks, but getting into like laying down. If some of yoga positions, there's oh my gosh, cobra pose.
Cobra pose. Okay.
Yeah. So just ways that you can get to simplify it, getting out of this flexed bent posture.
Start opening up the chest.
Up the chest.
Okay.
Yeah, especially pec muscles. Those always get really tight.
Yeah.
If we were to like feel each other's pec muscle and yourself, you might be like, oh yeah, there's a tight spot there, which is it happens. But as long as you know how to get out of those, and if you don't, then definitely ask a licensed professional, and they can help you.
Yeah.
But no, that's a really
Awesome.
good question, because it's very common.
Yeah.
Yeah.
It's cool. So preventive maintenance, right? It's always better to prevent if you can.
Yeah, exactly. Yeah.
So what? Okay, so if you could give one piece of advice to just the average person who is in their like let's say like late 30s into their 40s, right? So still can probably get move well, decently well.
Yeah.
You're not you haven't had hip replacements or anything like that, right? What is one piece of advice coming from like the mindset of a physical therapist that you would give to that demographic, like 35 to 50?
35 to 50. Yeah. Ooh, that's a great question. One piece of advice, I would say continue or start like strength training.
Okay.
So, mobility is really important, but in order to maintain the the integrity of the muscles and tissues, and even again like the bony structures, do start some sort of strength training if you haven't already. Now, a lot of the times, like even if you were an athlete at a young age, like you may think, oh, but I can't lift as heavy weights as I did when I was younger, and that's okay. But as long as we're loading the system, loading the body, and it will take time, especially if you're starting new, if you're starting fresh with strength training and haven't done that as much. I think that's probably my biggest piece of advice, to stay like strong and active, especially for your kids, for your grandkids, if you have them, and just for your mental, physical, and emotional, health. Yeah. So I would say that's the biggest thing. And with strength training, as we all know, there's movements that get us out of that, posture that I mentioned earlier. And again, you're able to load the system or the body, and do it in a how should I say, safe and progressive manner, especially when instructed correctly.
Awesome.
Nice.
That, what, I'm a living example of what you just said, because I used to just run and that was it. And running's great. It has a lot of benefits, but without the strength training, there was a lot of things that were starting to go wrong in my body. So strength training is non-negotiable. Absolutely needs to happen.
Definitely. And in all planes, we focus on, I do want to touch on this because that's really important. In cycling, riding your bike, walking, running, hiking, we're all in this one plane.
The sagittal plane.
Yes.
It's like you're exercising in a hallway.
Yes, exactly. And so let me add on to the strength training, incorporating movements in different planes. So frontal plane, that would be more of your lunges, getting into what we call the transverse plane. So doing more rotational movements, power. I want to add that on, strength training plus training in different planes.
Yeah.
I wonder if there's a gym around that does that.
I know.
I don't know. It might be.
Maybe, yeah.
Just for the record, we didn't tell her to say any of this stuff.
But I incorporate that as a physical therapist as well, and just doing more research as well as incorporating function, because I believe how should I say, doing exercises, especially after a session, like, if we go 1 week, then I'll say, all right, this is what I want you to do to maintain these, maintain what we've been working on. So example, I have someone right now, and she is working at a desk, and I gave her some mobility to do while she was at a conference, because she was at this conference for hours and hours at a time. I think she told me the longest day was like 9 hours.
Oh my gosh.
Oh my gosh.
Jeez.
Like that's a lot.
Yeah.
So being able to do stretches and exercises that incorporate into your functional daily life. Now there are other things that may not fit in. You need to like set a timer or set something on your phone to remind yourself. But I'm really all about functional movement and also incorporating like different like chains and planes of the body.
That's cool. So she was able to do those exercises you gave her in between sessions at the conference.
Yeah.
And was able to.
Yeah. And into her hotel room now, she was really sore. She was like, and that's, being like, sitting in a different position in a different chair.
Yeah.
She was like, yeah, I was really sore, but I was able to incorporate what you gave me into the breaks and in my hotel room. So
Nice.
More incorporating into, your life.
Awesome.
So
That's awesome. Even at a conference.
Even at a conference.
Still doing what you need to do.
I love it.
Yeah, exactly. Yeah,
That's
and
cool.
feeling empowered to do it and saying, yeah, like I can do this. And
I love it.
Again, there may still be, soreness, stiffness, like some pain, but she was able to continue to do what we came up with a plan together. Because it's not just all one-sided.
Yeah.
As you both know, it's a relationship. So that's what I really believe in.
Nice.
That's something that we're always trying to teach in the gym, is always something.
Yeah.
Like if you can't get into a traditional gym workout, what can you do? So I'm like, all right, well, during the conference I can do exercises between the classes and in the hotel room. I love that.
Yeah, that's really cool.
Yeah.
That's really cool. Cool. Well, we'll start winding things down here, but I wanted to give you a chance to kind of talk about Pioneer. This is really unique.
Yes,
in like
this
what
is
you
a
guys
very
do.
exciting model that you guys have in your business.
Yes, it is. So for those of you, Pioneer PT was started in 2017 by James Dolkarian. He's a Maryland native, and he had this dream, literally like sleeping, had a dream. In California, he traveled with his wife in a Volkswagen like Bug. If you put your surfboard on top.
I am loving this story more and more. Okay.
He's a surfer too, so they went to Big Sur, and he had a dream a few months later of doing this for physical therapy. And he's been practicing for years, and he was just burnt out and tired of the setting, the corporate insurance, all that. And he built out this mobile studio. So for those of you who are like, what? So think of a clinic on wheels. So if you think of like Amazon has these like Sprinter vans that they deliver your packages. So he built out a Sprinter van with a treatment table, equipment. There's a sink in there. There's like a shelf where we put other equipment, documents, and it's a clinic that comes to you. So it's really
amazing.
unique, and we can come to you at your home, workplace, on the trails. We go to a lot of events, and like Mark said, we love working with outdoor active individuals, and I truly believe everybody should like be in the outdoors, like go for walks outside, hikes, just because like I feel like nature is just what we all need. And so being a hiker myself, he is a mountain biker. That's how I got started. And I joined the team last year, and I'm just so excited that we are building, and I'm getting my own mobile clinic.
It could be
Yes.
2 vans.
Yep.
Woo!
Yep. So really looking forward to that. And yeah, if you are interested in knowing more about us and working together, then we'll have in the show notes my contact information.
Yeah.
Yeah, it's really super interesting. You guys have a good video on your website that shows the inside of the van and shows people actually in there getting treatments. It's really fascinating.
Yeah, exactly. Yeah. So
and I love the time saving aspect because a lot of people are really busy.
Yeah.
And so it's nice that this could come to you. You can get it done during your lunch hour at work or whatever, and then it's super cool.
It's a great idea for sure. Cool. So, all right, is there anything else you wanted to let everyone know about? Is there anything else you wanted to mention?
Oh, I just want to say, for those of you who are listening, and we've all gone through so much over the last. I'm just gonna say like 3 during this whole time. And if you feel like you're stuck or you need that motivation to start somewhere. If you feel like you were working out consistently, fell off, you're trying to get back into it. We're in December of 2022 as we record this. So wherever you're listening, just know that you'll get back to it. But just don't rush the process.
Yeah.
It is a process, and find those like Lynette and Mark that can help you and make you empowered. And just to give you guys a shout out, when I found out about Progressive, what I found so like unique about what you both do in the workouts, the first thing I saw was the Trek Hall climb.
Yes.
Correctly? Yeah.
Yes.
And, being in the outdoor, I was like, oh yeah, I'm like all about this. And then when I came to the gym, how you incorporate, like mobility and strength and, functional movements. Like I have looked at other gyms here, but there's nothing like anything here. And you both.
We did not pay her for this.
Yeah. So I just want to, it's really cool. So I just want to say that. And what you both have done is incredible. And I can't wait to see what's to come.
Yes,
awesome.
the whole Treks and Climbs. That is a preview of things to come in January.
Yeah, that's a couple weeks.
Yes.
A couple weeks for rolling that out.
Yeah, so. That was a little teaser there.
Yeah.
Cool. All right, well, last question we got for you. What are 3 things that elevate your life?
3 things that elevate my life are, I'm going to group these together, but travel and food. I definitely like bucket list is to travel to all the national parks in the country.
I love that.
Yeah, so national parks make me very excited, but then also like traveling outside the country in places where there's mountains and hiking. I just love that. So I would say that's number 1. Number 2 is community. I'm very community like driven, and I love forming relationships. So people elevate my life, and I couldn't be where I am without my community. And I would say the third thing is, I want to say personal development, but just learning more about business and myself, and continuing to grow, and not being the same person I am right now in December of 2023. So like developing myself. And it's hard, but I just find it rewarding. So
that's
awesome. Always growing, always learning.
Yeah.
I love it.
Yeah. Cool. Well, we appreciate you coming on.
Yeah.
Dr. Mace.
Yes.
Yeah. Thanks for coming in person. That was fun.
Yeah. This was great. Thank you for having me. And thanks for listening. And if you have questions, anything about what we talked about today, feel free to reach out to us, and I can, dive more into if you have any specific individual questions.
You also have an Instagram, right?
Yes.
Yeah.
Oh yeah, the socials.
What's your handle?
Yeah,
yes. So my personal one is just gabbymace.dpt, and that's Instagram. Facebook is my name, and then you can also follow Pioneer PT MD on all of the platforms, and there should be more coming soon about the current build out, and then the new as I should say, like relaunch of expanding Pioneer PT.
Yes, and the relaunch is going to be here.
Yes, I hope so. Yeah.
Yeah.
It would be great to have just the community that I've met over the last year and just like have everyone together. So yes, I'm very excited. Very excited about that.
Awesome.
Yeah.
I should have said this in the beginning, but some of our clients, if you're watching this, you might recognize Gabby because she has shown up for some workouts as a client.
Yes. Yes, exactly.
So you're like going, wait a minute, Gabby's a doctor? What?
Yeah, I'm usually in this I'm pointing at the corner right here. But yeah, I definitely get challenged when I'm here, and I love it.
It's fun. It's always fun having you here.
Yes.
Cool. Well, hopefully this was helpful, guys, and we will talk to you next time.
All right, bye.
Bye.